This video is about managing side effects with medications. So if you are on chemo, you're going to have side effects from ABVD probably. Maybe you'll be lucky and there won't be any side effects, but for the most part, I haven't been that lucky. I seem to have gotten the grab bag of side effects from treatments, so there are some things that you can do to cope with side effects, and I've got some suggestions to help you with doing that as well. And this is also for anybody who has family or friends who are going through treatment, so you can know a little bit about it. And my next video will be more about what the side effects are. So the major side effects from chemo that are difficult to cope with, that I've dealt with, are nausea, and nausea caused by indigestion, fever, pain management, anxiety, and depression. I'm already prone to anxiety and depression, but I've heard that people who have never experienced that before have gone through that. So I've had some friends who have been treated with chemo who have had to deal with that as well. And of course it's rather disrupting to your life, so it can be difficult. Now, to give you an idea of how much medication I have taken besides the chemo drugs, I have been on ABVD for 6 months, and in that time I've taken approximately 951 pills just to manage the side effects. And along with that, I've done some kind of home remedies, and I always make sure you talk to your doctor, like I said before. Anyhow, some of the things you'll do before treatment: you need to go visit your dentist. Yeah, a lot. So important things to deal with side effects: brush your teeth. Whenever you eat, brush your teeth right after. Make sure you've got a really soft bristle brush for brushing your teeth with. My dentist hooked me up with a really great one made by the gum company, and extra soft bristles would be nice. But I found that if I brushed my teeth after every single meal, I had less trouble with mouth sores. I don't know why, that was just a thing. Also, regular flossing, and along with that, you can do some mouthwash. Make sure that it's alcohol-free. You don't want to get an alcohol, okay, some of the ABVD drugs, as well as some of these other medications that I've taken to cope with side effects, really bad interactions with alcohol. Don't drink while you're on treatment at all. Also, my doctor gave me a great fluoride rinse. Now, you may not know, but I've been lucky as far as dentistry, dental care goes during my lifetime. I've never had a cavity. I've never had a bad tooth. I've never had to have a root canal yet. And I'd like to keep it that way. So fluoride rinse, and he just had me do a really tiny amount, rinse, spit, once a day. So go see your dentist before you start treatment. These are great. It's just paper cups. I keep them in the bathroom, so when I've had incidences with vomiting and whatnot, it's great to be able to get some water, swish it out, and then I can just toss the cup. I don't have to worry about washing it or making an extra effort to go put it in the sink or anything like that, or trying to drink out of the faucet. So that's great. Lotion for dry skin. That's another thing you can do on the side. Disinfecting wipes. I live in a house with 7 other adults. They all work with large numbers of people outside the house. Some of them are going to school. Some of them work at schools. So I've had people at the house who have had mono and strep and the flu and colds all while I've been on treatment, and I've managed to stay free of getting sick, which is great. And I'm going to go turn on the light because it's starting to get dark. Okay, so disinfecting wipes. it makes it easier to clean. Normally I just use rags and chemicals and stuff. This time I've gone and I'll put on some gloves and then take just a disinfectant wipe and go over all the surfaces that are regularly touched by other people, especially in the kitchen. And I do that. The kitchen I do once a day because I'm in there eating all the time and I don't want to pick up anything that somebody might have accidentally put down. So I'll do that in the morning after everybody's left. And then the other surfaces in the house I do once in a week, so things like doorknobs, and we have a baby gate for the dog, so do the handle on that. So it's worked out for me. I've had the Clorox wipes and I've had these that some people brought for me, so that works really well. Also, along with the gloves, you can get viral masks. And they don't work for very long, they're only good for about 15 minutes, but if you ever have to go out to in public and get medications and pick them up, and we're being exposed to a large number of people and cash registers and things like that, cash registers, cash, money, or having to deal with, you know, the little keypads that you run a card through. Gloves can protect you from picking stuff up there, and I usually put on a viral mask as well. Just in case. My doctor said, well, you know, the public, no one's going to sneeze on you. Well, guess what? I've had 2 people in the past couple of years sneeze on me full in the face, cough on me full in the face, and I got sick directly after. Now, part of that was because I have a lowered immune system due to the Hodgkin's, but guess what? Chemo's really killed my immune system even more. Also, you're going to want to pick up a good thermometer. This one is one of those ear thermometers, and it has, I don't know if you can see it, I'll hold it a little closer. It's got a little plastic shell that you can put in, so you can put it in the ear and keep it clean. And I've got some of the extra covers for it. So yeah, I've used this a lot. I've had fevers, so this is really useful to have to help make sure that those fevers aren't getting too high and dangerous, and also so that you know if you have a fever, so you can take something to help keep it down from getting too high. Also, highly useful pill boxes. So this is one of those ones that has the days of the week on it. Chemo brain makes it foggy in the head, hard to remember things. I'll take medication and then forget I've taken it. And you don't want to be doing that when you're taking things like warfarin and other stuff. So get the days of the week, anything that you have to take every single day, you can just put it in there, and then I'll strap on my my pill boxes. I got 2 rubber bands on here to strap on for anything that's in there, so that I can look at it to see side effects. So if something happens to me, somebody knows what I've been taking, and I take that with me everywhere I go. And medication calendar. So on this calendar, I've kept track of side effects that I've been experiencing. I write down any medication and the time that I took that medication at, as well as writing down the amounts of water. So what I'll do is I'll go get my pills, put them in my hand, go up to the calendar, write down the time, write down what those medications were, and keep that all on the calendar for easy reference, so right next to where I keep my pills, so that I'll know, okay, I just took something, I don't want to take it again, or, oh, I haven't taken that in a while, and I'm starting to get nauseated, and, but I don't, it's been too recent, so I need to wait a couple hours, or, oh, I can take my pill finally. Yeah. So that's been really, really useful, and I highly recommend it if you can get one. So for pain and for fever management. Now, I have heard that some doctors in Australia at this time are recommending ibuprofen for pain management and dealing with that. My doctors advised strongly against taking any ibuprofen, which is usually my painkiller of choice, because it can cause bleeding and bad interaction with some of the other drugs that I have. So acetaminophen, Tylenol for people who know by brand names. And there is a maximum amount you should not be taking too much of this acetaminophen. I think it's like 3,000 milligrams. Don't take over that because it can be toxic if you take too much in a day. So once again, keep track of how much you're taking and don't take it unless you have to. For pain, I have dealt with a lot of pain in my life because of martial arts, and I've done things like I cracked my shin from here all the way down to my ankle. It took 2.5 years to heal. I've had horrible back pain and whatnot from the Hodgkins and things like that. When you approach pain, don't think of it as I need to cure this pain. Think of it as I need to manage this pain. So if you're having trouble sleeping because you're in pain, take something. If your fever is going up, take something. If you're uncomfortable, you'd probably better approach it with distractions. That's going to be more useful than just taking something to make it go away. For nausea, now I had a lot of indigestion, and I used this in the past when I got really, really sick, and that's for another day, that story. But omeprazole, also known as Prilosec, and that's all of these. Take it once a day, it helps keep the indigestion at bay. Next up, we have ondansetron. This one's a common one used for women who are pregnant. It's pretty safe on the whole. You can take it once every 6 to 8 hours, and it is kind of expensive, but it is useful, very, very useful for helping keep the nausea. And I've had this. I'm going to be so happy when I don't have to take these anymore. All those. Next up, we've got promethazine. Now, they've given it to me IV while I've been in surgery to diagnose the Hodgkins. They also have given it to me IV when I've been in for treatment, for chemo treatments, because I've had such a problem with vomiting. I'm not a fan of promethazine. It makes me agitated and jittery and in a horrible, freakish kind of fashion if they give me a lot. So I don't like it, but on the other hand, it does take care of nausea and it does make me sleep. So when I have days of nausea, I usually take this in the evening. Excuse me. I'm belching all the time, regularly. Anyhow, this is another one that you don't want to take if you're going to go driving somewhere or whatnot, because it can cause drowsiness, but useful if you're having trouble sleeping. So yeah, promethazine, awesome. On days when I don't have nausea but I need to sleep, I usually take an antihistamine, commonly known Benadryl. I always do the knockoff varieties because they're cheaper. Anyhow, so I'll take 1 to 2 of these. And Benadryl, it's pretty safe as far as medications go. I've heard of people even giving these to their dogs. Yeah, this is the one that I like to help me sleep at night when I'm not dealing with nausea, but I'm having lots of trouble sleeping lately. Not only going to sleep, but being able to feel awake. So yeah, fun stuff. This is Senecet, and this one is commonly known as Colace. These are for if you're having problems with constipation. What is this one? Docusate sodium. So that's the generic name for it. So anyhow, this one's an all-natural one. Senecet's awesome. And this one helps. So I have had troubles with constipation directly after chemo. I found that upping my water intake significantly reduced that, so that I didn't have to be taking this all the time. Yeah. But one warning, don't take this and then decide to go walking somewhere or whatnot, because I'd had really bad constipation for 3 days. I took this and decided to walk my sister home that night. I was lucky there was a park nearby with a restroom open. Anyhow, also Also, anti-diarrheal medication. I haven't had to deal with this. I haven't had severe diarrhea except for on days when I had to go in for a PET scan and when I went in for CT scans. And then I had major diarrhea, but honestly, I didn't want to take anything because I was like, the quicker I can get that crap out of my body, the better. So, if your pain's really, really, really bad and it's making you ill, then in terms of pain management, that is when I personally, as a non-medical person, would recommend taking something for it. My one incidence of that is when I made myself really sick one day by pushing myself really hard, and then I got a horrible, horrible migraine. Now, in my life, I've only had 2 occasions other than that one in which my migraines have made me vomit. And this was one of them. And you might think, oh, why would you take something if you're already guts or having a horrible time and whatnot? Well, my migraines, when they get really bad, they don't get better unless I medicate for it. In the past, when I've had concussion, migraine, stuff going on, I went for 5 weeks and tried not to take anything for it. And it just got worse and worse and worse and worse. So, yeah, if you know what I'm talking about, you can break down and take something. So I took naproxen sodium, only had to take it once during whole treatment. Yay. Otherwise, just avoid all of those NSAIDs, the NSAIDs, because of, bleeding. And you don't want to do that yourself. Ibuprofen. So, I did get ibuprofen 800 prescribed to me right after surgery because they normally will give you a narcotic painkiller in the US to help deal with surgery. And I've got a couple of problems with that, one of them being that it's highly addictive for a lot of people, and I've known people who have had addiction to painkillers, and it's rough. And I'd rather deal with the pain than deal with being addicted to a painkiller. I realize that for those of you with chronic pain out there, and I'm one of them, that maybe there are better options for you than what I'm recommending, so this is just my personal view on it. But ibuprofen 800 works for me. I went in with pain that was causing me to go into shock, and yeah, really, really bad. In 2009, that was actually caused by the Hodgkin's. And what the doctor told me is probably one of my lymph nodes was swelling back there, and it was pressing on my spine, which in turn caused the pain, and it's why they couldn't figure out what was wrong at the time. Anyhow, they sent me home with a prescription for Vicodin and ibuprofen 800 and a muscle relaxant called Baclofen. Muscle relaxant didn't do anything except upset my stomach, and the Vicodin did nothing but give me crazy mood swings and then help me sleep, which, it's okay, but whatever. And ibuprofen 800 worked great, but like I said, I couldn't take it because right away they put me on ABVD and warfarin for my port that I have here, as you can see right there. And you don't want to be taking ibuprofen, bleeding, right? Anyhow, I've had problems with dry eyes. My doctor said that's not normal. Normally watery eyes is really common with ABVD. So anyhow, my optometrist, who I haven't seen in a number of years because I have fabulous eyesight, yay, recommended eye drops, and that's been working for me. But I've had some vision problems, so yeah, eye drops, that's another thing. Mouth sores. So this is a lovely solution that my doctor had mixed up for me. It's got basically Benadryl, lidocaine, and I don't remember what the other one is, magnesium. So it's got BLM suspension, and this stuff is nasty, nasty taste. So if you have to take it, hold your breath, plug your nose, take it, swish it, swish it, swish it, swish it, swish it, and then this is a swish and swallow. Some of them are swish and spits. This is swish and swallow, Now I know what lidocaine tastes like. Milk of magnesia, that's another thing that you can use if you got constipation. I used it once. Yeah, didn't have that bad. So, if you ever have to go in for a CT scan, I think you'll know what this is. Barium solution, and I just brought a container to kind of show you what it looks like. Anyhow, it's really creamy and everyone's all grossed out by it. But honestly, all food is gross to me right now. This isn't so bad. I could swallow it, keep it down, even when I was having bad problems with indigestion. So, hey, it'll work out. And yeah, that was just for fun. So, one of the medications that they give you after you have ABVD is called Neulasta, penfilgristim, something like that is the common name. Anyway, Neulasta, it's awesome because it helps boost the immune system, and if you had ever seen my blood charts when they take my blood, every time I go in and look at what all the components look like, yeah, there's a lot of factors that are down to the high old number of 0. So Neulasta helps kick the immune system up. And Neulasta, the bad side effect. Neulasta, when it goes in, hurts a lot, but the bad side effect is it can cause bone pain. And if you've dealt with growth pains in your legs, you'll know what I'm talking about. It can be pretty severe. I had some unusual side effects with that. I'll talk about that later, but this is what my doctor recommended to go with that. It is loratadine, commonly known as Claritin. And apparently they found that women who were taking Claritin when they were going through ABVD for chemo, and they were getting the Neulasta shot, they didn't have as much bone pain, or they didn't have any bone pain at all if they took the Claritin. So this is a possibility. It may have worked a little bit for me. It certainly didn't take away all the pain for me, but there you go. I kept trying it anyway, just for the heck of it, you know, anything to help. Warfarin. I'm going to be on this for a while. My doctor said, yes, I can have the port out right after they check to see if I go into remission, but realizing that I was diagnosed at stage 4, she recommended that I keep the port in for at least a year, just in case I come out of remission anytime soon, which is very possible. So I'm going to be on warfarin for a while, so I'm going to read off some of the things about warfarin. One of the things, take it regularly, in the amount that you're supposed to. Don't use this medicine if you plan to become pregnant. But then don't get pregnant while you're on ABVD. It would be stupid. Yeah, don't do it. Contact your doctor if you develop any unusual or persistent bleeding. Don't drink alcohol. Yeah, don't drink alcohol while you're on the medication. Don't take aspirins or other NSAIDs without checking with your doctor. And read the medication guide. And by the way, medication guides. I keep all of my medication guides here together in the folder that they handed out to me. Aren't they nice? Yeah. So, yeah, and read through them just so that you know what the major side effects can be that are dangerous, just in case something pops up. So you can call a doctor or go into the emergency room if you need to. I haven't had to do that, but it can happen. Let me see, what else do I have up here? Azithromycin. Okay, so I ended up getting kind of huge inflammation in through my sinus cavity and down here at the base of my skull, which it could have been from something else, but the doctor at the time thought, well, it might be an infection, so let's just go ahead and give you this. Azithromycin is kind of a generic sort of antibiotic, so it's good, but if you ever have to go on it, I had terrible diarrhea with that one. Alright, some more containers of the omeprazole. And these three, or other medications that I was on while they were diagnosing me. So I think I'll talk about them when I talk about the history of my diagnosis, which is really strange as far as that goes. Anyhow, so I was lucky with my fevers. I only had in between 97 degrees and 99.8 degrees Fahrenheit. It didn't go way up high, but you know, if you have high fever, you'll know. Go into the emergency room. It can be a really bad sign. Along with these other things I talked about, let's see, did I bring one? Yes, I did. Vomit bag. So if you're starting to have nausea, ask at the hospital when you're getting treatment. Tell them that you feel like you're going to throw up, and just have it there in case. I was good for the first 3 treatments, and then it was like they couldn't get me to stop vomiting during treatment. So, I also have a bucket, and this is useful for cleaning up after you've had a vomiting spell at home or vomiting into it, and it's going to make your life a little easier if you have to deal with that. You might want to get a good towel and put it with it just in case. Maybe you'll be lucky. Maybe you won't have to deal with it. So here I'm going to talk about some non-drug coping techniques and whatever you can do to cope with the kind of things that come up with anxiety and depression. So pets, if you have a pet, dogs, cats, fish, it's great. They don't require a whole lot of high maintenance usually. However, if you do have cats, you're going to need to have someone else cleaning up after them. You can't do it. It exposes you to too much. Dogs, fortunately, there aren't a lot of illnesses that we can get from dogs, and fish. Yeah. So pets are great. They can keep your spirits up. If you have a child who's going through chemo, you can get a pet, like a dog, for this kid. And I always recommend going to adopting agencies. Don't get puppies because they can be a little high-strung. They do a lot of chewing and biting, and that can be hazardous to the child. But if you get an older dog that's sedate, it can be a great family pet, and it can be a really good companion to your child while they're going through chemo. However, just know that that child or person who has a pet, they might not be able to keep up with the pet in terms of care during chemo. So you got to be able to do that. Otherwise, if you guys have family pets already, it's going to be awesome. It's going to be really helpful if they can be around that pet. Yeah. Music. So this is something that I do to cope with anxiety during treatments and also with pain at home. So distract your mind with music, just any music you like. It's really, really awesome. I would take a player with me when I'd go in for chemo after I realized that I'm just going to be vomiting during chemo the whole time. And I would plug that puppy in, put on some headphones, and just listen to it and really focus on the music and try not to think about discomfort and just try to relax. Along with the music, if you do meditation or if you want to learn meditation and meditative techniques, it can be very helpful while you're going through chemo. Also, if you ever have anxiety building up or depression, do some meditation exercises. It's awesome. And if you don't know how to meditate, you can do things like go for a walk, which is a meditative exercise, or do some dancing. That's another great meditative exercise. Also, yoga is awesome. Art, even coloring books. So I do some, I am an artist, I do some art, but I can't do nice art right now. It's all squiggly and nasty. Coloring books, however, try to stay in the lines, and it's still an art activity, so that's awesome. Social media has its ups and downs. I can stay in touch with my friends. Yay, hi friends. With social media, and I don't have to worry about being trying to transport myself to where they are, or have them take the time to come visit me. I can just talk to them on social media. But the downs, if you find yourself getting depressed, if you're on social media, don't do it. Also with social media, there's a lot of people who do blogs or video logs out there on chemo and going through, and that has been a really great support, especially if you've got Hodgkin's. There's not a lot of people out there who deal with Hodgkin's. It's a really rare kind of cancer. So there's also educational videos you can watch about cancer and about cancer treatments, and just about any topic that you're interested in. For me, that includes things like religion and history and chemistry and physics and poetry and dance, and yeah, there's a lot of stuff out there I like watching educational videos about, so that's awesome. Other than that, I think that's about it. That wraps up for managing side effects with medications. And like I say, think of it as management, don't think of it as a cure. It's just there to get you through. And you may have some really, really bad days. While I've been on treatment, I've had some people I know have died from cancer. And of course my father died from myelodysplastic syndrome due to his exposure to chemicals in Vietnam, which is a really, really unusual condition. At least his specific variety is a really usual condition. And yeah, that led to some hard days. And my friend who died from lymphoma, which, you know, Hodgkin's is a kind of lymphoma. So it can be rough sometimes. And if you need support, turn to your family, turn to your friends. They care about you, they love you, and they'll want to help. You don't necessarily just have to turn to medications. If you don't have friends and family around, there are support groups for people who are going through chemo or people who have cancer, and there are online support groups for it. Also, you can, if you're involved in religion, you can turn to your local pastor or minister or your local congregation and try that out. Or if you absolutely wouldn't want anything to do with that and you still need help, you might be able to turn to a counselor or social services in your area. So even reach out to your neighbors. And good luck with everything, and I will talk in my next video about some of the side effects that I've dealt with from ABVD. And like I said, I got the grab bag, so I pretty much had almost everything out there that you can get from chemo and from ABVD treatment, and some ones that they didn't even list. So yeah, my doctor, I tell her, and she looks at me like, what? That's weird. Oh, hello, Kaya. My dog decided to come join me. So, anyway, good luck to everybody, and I will see you later.